The best part about ultrasonography is if you're a licensed veterinary technician, it is actually most states in their practice plan basically allow ultrasound as part of performing a medical service. And so as long as it's under the supervision of a veterinarian, you can perform the ultrasounds. You can even do the ultrasound guided aspirates, to my knowledge, as long as there's a veterinarian in the room while you're doing it. So that's one of the first things that a lot of people always wonder. And we actually do a fair amount of training programs for technicians, because the biggest thing is veterinarians really have a hard time with taking the time out to do a 30-minute ultrasound exam when they could be seeing 2 other patients at that point in time. And to be honest with you, ultrasound is a technical skill. There are 12 organs in the abdomen, they never move, they're always in the same spot. The interpretation's the hardest part. And so as long as you're getting good quality images and recognizing what normal versus abnormal is, that's sort of the big key about ultrasound. Because if you can't recognize, the idea is you can't recognize the abnormalities, you'll never take a picture of it. So taking a lot of normal ultrasounds and practicing with a lot of normal animals is kind of the key. And the biggest problem most people have is nobody has the time to look at normals. They're always seeing cases. They're always doing the abnormal case, and so you never really get that kind of mindset into your head of what a normal looks like. I guarantee you, if you know what a normal liver looks like, when you see a liver mass, you're going to be like, that's the worst case of whatever it is I ever saw. So it's much easier for that. So the biggest thing that I'll tell technicians is the problem is they kind of get sandwiched a little bit in being asked what they think it is. And just realize that the best part about being a technician doing ultrasound is that you're never wrong, because you're never going to make a diagnosis. If you just say the liver looks strange, that's as far as you need to go. You don't need to look at it and say, oh, I think this is hepatocellular carcinoma, because even veterinarians can't figure that out. And the only reason why we'll say this is mast cell disease or this is vacuolar hepatopathies or some other differential is because we're taking the dog's signalment, the history, pathophysiology, and all these other things into account. So as long as you just say, hey, I think the liver's abnormal and he has elevated liver enzymes, the next step is to try to figure out what you're going to do to make further diagnosis.